Good morning, it's Tuesday the 30th of April. Our main story, a public inquiry is due to hear evidence today into how thousands of patients died after being given infected blood in the 1970s and 80s.
The government has announced an increase in financial support to some of those affected. Here's Sophie Hutchinson, our health correspondent.
It's impossible to know exactly how many thousands of patients the NHS treated with bad blood in the 70s and 80s. Estimates suggest 5,000 people with diseases like haemophilia, but possibly as many as 30,000 others who received blood transfusions. They were infected with life-limiting diseases such as hepatitis and HIV.
When they told me what they'd done to me, I stood at a motorway bridge to jump off it.
That film was how the infected blood inquiry opened last autumn. Since then, its officials have been working to prepare for today, the beginning of the evidence from those infected.
This, for the first time ever, is the time when people's personal testimonies are going to be heard, the infected and the affected, about how this has devastated and traumatised their lives. And the fact that so many of these people have led quiet lives of desperation away from the camera because of the stigma around it all and because of health, the disastrous health consequences they've suffered.
It's believed at least 3,000 people infected in this scandal have now died. Those left behind and others infected want answers about how and why such dangerous blood was used by the NHS. Sophie Hutchinson, BBC News.
And at 8:10, we'll be speaking to the widow and daughter of a man who contracted hepatitis after being given infected blood during a routine dental operation.